I'm not a doctor, I'm not a physician of any kind, I'm not a chiropractor, I'm not a nutritionist, I'm not a dietitian, I'm none of those things. So please don't take this video as medical advice. Again, I'm not a physician, not a nurse, nothing in the medical field, not a dietitian, nothing like that. Don't take this video as medical advice. So, a while back, many years ago, I stopped taking calcium because of there was research done that showed that it could lead potentially to heart disease. Okay, so I didn't have any health problems while I was taking calcium. In fact, my blood calcium was normal. It was in the high range of normal, but it was still normal. And a lot of people don't understand this. When I tell people not to stop taking supplements, I'm doing this from personal experience. A lot of my health decline, now to be fair, it did start primarily after being homeless for 4 years and being malnourished for 4 years. However, I never got back to supplementing like I used to. I started falling into the nonsense that you can get the majority of what you need from your food, except for maybe a multivitamin, blah, 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 blah. And I quit supplementing with my bodybuilding supplements like I did really since I was a teenager or a young, about 17, 18, 19, 20 there. And I quit supplementing with a lot of the supplements that I took, and one of them was calcium. Another one was magnesium. And this is not my video on calcium. This is a separate video that I'm doing specifically based on my heart health and how I'm now experiencing tachycardia and things like that. Now, it was many years ago, probably about 6 years ago or so, it was determined that calcium supplementation may increase the hardening of the arteries. Now, I didn't stop right away taking the calcium, but probably about 4 years ago, because of Dr. McDougall, for whatever reason I trusted McDougall. I thought he knew what he was talking about. He does not know what he's talking about. And I should have stuck with the health advice of people like people like Adele Davis and Dr. Robert C. Atkins, and people that actually know what they're talking about when it comes to nutrition, because clearly Dr. McDougall does not. And so I stopped taking the calcium, and this was prior to me developing, I developed my tachycardia at a weird point. It's kind of hard to determine what exactly caused it, because it was an extremely stressful time, but it was also about 3 years after I went all in. No, I guess it was a little over 4 years I stopped taking the calcium, then probably about 5 years ago. It was about 3 years after I went all in on this crazy starch solution diet. Now, I did keep taking my multivitamin, which has a little bit of calcium, but not much. And I did take, I think I took creatine monohydrate was what I was taking too, which actually might explain the muscle growth, but not really, because I was taking that before the starch solution. Like I said, the starch solution really did pack on the muscle. I was amazed. And I mean, it was remarkable how much muscle I put on a starch-centered diet with very low protein, very low fat. However, I was not supplementing with my calcium or my magnesium, which I at the time I was taking in tablets. Now I'm taking it in powder form. I put it together with my orange peel. I put a serving of the calcium citrate, a serving of the magnesium citrate, 3 tablespoons of the orange peel, and a sweetener of some kind, usually saccharin or sometimes, aspartame. And I shake it up in a shaker cup and I take it. Sometimes I might put some amino acids in there, but usually it's just the calcium citrate, magnesium citrate, and orange peel. And it tastes great, and it's giving me my necessary minerals without any of the detrimental sugars and things of that nature. And it's also giving me a happy dose of the phytonutrients that I want for my heart health as well. So essentially what I'm getting at here is, and you will see with the links in the description, calcium is remarkably important to the health of the heart and to the health of the blood vessels, to get the endothelium to operate, to get all of the muscles in the body to operate properly. Now, that could explain, now what was funny is, one of the things that got me taking it was Dr. Wallach likes to talk about how when he was a kid, he had a facial tic, like Tourette's, and he started eating, I guess it was lamb chow or something. But by that I mean it was like the chow given to lambs or something like that. It was alfalfa that had quite a bit of calcium in it, and it got rid of his tic. Now, I was having tremors. I would shake a lot and things like that. And honestly, that was helped primarily by the chiropractic, when I got a couple adjustments by the chiropractor. So that was helped primarily by the chiropractor. But with the heart, like what I'm doing now is I'm adding back all the supplementations I used to take to prevent heart disease, which include, of course, all of the B vitamins, but especially thiamine and riboflavin, and B12 and folic acid. But also the calcium and magnesium are extremely important, and you need both. So, like when these things are saying, you'll see there's not really any great research proving that calcium is harmful to the heart, and that's very important to understand. And a lot of health professionals are saying, don't stop taking calcium. Do not stop taking calcium. I'm not a health professional. I'm not a doctor. I'm not a dietitian or a nutritionist. I'm not saying to do anything. Don't take anything in this video as medical advice. It's not. Don't take anything I'm saying as advice. I'm not giving advice. I'm saying what I'm doing for entertainment purposes. So I've started taking, I take maybe 3 or 4 servings of this, which is about 150 to 200% of my daily allowance of magnesium and calcium a day, unless I'm eating a lot of tofu. If I'm eating 2 to 3 pounds of tofu a day, like I do sometimes to drop weight and to add muscle, no, I don't take the calcium like I do, because then I'm getting quite a bit of calcium from the tofu, more than I would actually be getting from the supplements. And that's the thing, is they'll say, well, calcium from foods is not dangerous at all, blah, blah, blah. Well, in that situation, I'm getting far more calcium than most people would get by supplementing from tofu when I'm eating the tofu like I do. And people don't grasp sometimes the amount of calcium in their foods that they're taking in, even like leafy greens and things like that. But ultimately what I found out, I believe in the orthomolecular approach to psychiatry. The concepts of Dr. Abraham Hoffer, the concepts of Dr. Linus Pauling. I do believe that some people have unique biochemistries where they do need more of certain nutrients. For me, it seems to be I need more of certain minerals. Now, this makes sense. And again, I'm going to quote Dr. Wallach. You know what? I'll put a couple Wallach playlists in my my description here. But when somebody like me that is physically active, regularly physically active on a daily basis, I require, if you're only putting back in salt and water, and for a while I wasn't even putting salt back in because I started listening to people like Dr. Greger and Dr. McDougall and people like that, it depletes these necessary minerals and these necessary vitamins, like, for example, thiamine and B12 and things like that. So if you have to, and remember, if you're physically active, you have to ingest more fluid than the average person, or you will suffer dehydration. But you also need to add in those minerals, and you also, like, for example, you need your sodium, your potassium, your magnesium, your zinc, your calcium, your copper. All these things are necessary for the proper functioning of the body. And if you're sweating them out and you're urinating them out, by hydrating enough to keep yourself physically active, you're going to essentially develop deficiency issues. whether you know it or not. And not everything can be supplied by food. For example, of course I eat seaweed to make sure I'm getting my microminerals, but seaweed can only provide so many microminerals, particularly iodine. It's good for iodine, and it does have trace amounts of the other ones, but I also supplement. And I started doing this when I basically, Dr. Wallach reinvigorated my ideas in the past, and I even bought a book on non-human primate nutrition for laboratory animals. And why did I do that? I'm a big believer in the fact that you need to start with a relatively, what is your natural diet? And the natural diet of the human is predominantly plant-based. And then you can, a lot of the animal things can obviously be taken care of perfectly with supplementation, such as hemp protein, tofu, soy protein, different types of protein, plant protein substitutes for the animal protein, and of course the B vitamins, and blah, 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 blah. So, you're not losing anything on a 100% plant-based diet. But you want to start with as natural, what is the species-specific diet, and then you want to supplement with these things. This is what they do with livestock. This is what they do with laboratory animals. This is what they do with your dog or cat. This is why cat food and dog food have these things added. And I'm going to be making a video about how Unnatural Vegan is an idiot when she says that basically you can feed a cat a vegan diet as long as it has taurine in it. That's not true. You cannot feed a cat a plant-based diet because it's not healthy for the digestive system. Cats are not made to digest plant matter, whether they have taurine or not added to it. So I started reevaluating the way I was looking at things, and I realized, I need to go back to doing what I was doing when I was healthy. Because I was healthy on any diet I was on, predominantly because I was eating enough of the macronutrients in the right proportions, and I was getting a lot of nutrients, micronutrients, and coenzymes, and other things that you can't get from food from my supplementation regime, like my coenzyme Q10, my alpha lipoic acid. You can't get these things from food. Creatine monohydrate, and a lot of the amino acids, you can't get those from food in the proportions that you're getting from the supplements. And that is what they do with with animals. That's how they prevent illness in animals. That's why animals, generally speaking, are a lot healthier than people in the United States. And so I guess the gist of this story is, don't follow, and I was misled by gerontologists. And that's the thing, is you have to learn, I knew more as a personal trainer about how to live to 100 than many of these gerontologists do. And that's, I think, because these gerontologists live in the laboratory world. And again, I'm not saying I'm a gerontologist. I'm not saying to take my advice. I'm not saying to do what I'm saying. But I got very sick listening to the advice of gerontologists that embraced the ideas of Dr. McDougall and other similar doctors like Dr. Dean Ornish. And I had to go back to a high-protein vegan diet, a bodybuilding vegan diet. I still do some intermittent fasting for 12 to 16 hours a day, but I'm not messing around with any of this crazy nonsense of low-protein diets and low-fat diets and all that. Well, my diet is technically, I guess it would be moderate fat to low fat. It depends on the day I'm eating. But I don't mess around with any of these crazy diets. I went back to what my nutrition training told me from being a personal trainer and reading my books on nutrition and the textbooks I've bought on nutrition and the books I bought on primate nutrition and the book, and not the popular culture book. That's the thing, is don't believe what the popular culture book authors say. With the exception, the thing with Dr. Atkins is I promote the Eco Atkins diet, not the original Atkins diet. But the thing is, Atkins, especially with supplementation, is somebody that people really, really should pay closer attention to. His use of supplementation in place or in conjunction with medicine saved many of his patients' lives. Okay? And that is shown by the clinical evidence of his patients. And that's what a lot of people are not paying attention to. They think Atkins is the diet and only the diet. He is not the diet. He is more than the diet. Okay, he was basically a complementary or an integrative physician, an integrative cardiologist that made use of nutrition as medicine. All these vegans that are saying, let food be thy medicine, and I'm not dissing veganism. I am ethically a vegan. That is why I don't eat animal products. But this vegan concept of low fat, low protein, no exercise in some case. Some of them don't believe in exercise. This is damaging to the well-being of veganism as an ethical movement toward reducing animal cruelty or eliminating animal cruelty. I think that, more vegans should take into consideration that if they're healthy, they have a better chance of converting people to veganism than if they look like a stick figure or are obese, okay? And that's the thing, is I think that there's more information that can be garnered from people like Adele Davis and people like Dr. Robert C. Atkins, as well as traditional. Buy a textbook on nutrition, like Krause's textbook on nutrition. Learn about nutrition. Understand human nutrition. Understand primate nutrition. Understand that humans eat a certain way. And a lot of this nonsense, like the paleo diet and the carnivore diet and the vegan diet and the fruitarian diet and the starch solution, these are extreme diets that cause extreme health conditions. Now, what I would say is, obviously, don't eat refined food if you can help it. Okay, but what is refined food? Tofu is refined food. So when I say refined food, protein powder is refined food. I'm not saying don't eat protein powder. I'm not saying don't eat tofu. What I'm saying is, we know what refined foods are. Cookies, candies, pastries, things like that. Olive oil is a refined food. Canola oil is a refined food. Eat these foods, but don't eat the refined carbohydrates. Okay? That's extremely damaging to the health. I am happy that Greg Doucette finally did a video again on artificial sweeteners. I thought it was high time he finally did one, because everybody's so worried about artificial sweeteners. I've done videos on artificial sweeteners myself. The thing is, these refined products, even fruit juices, these are what are damaging people's health. Sugared soda, things like these are what are damaging people's health. It's not the tofu, the protein powders, and things of that nature. And I think that people need to take into consideration, don't do what I did and trust somebody like Dr. McDougall. My problem was I was getting such good results on the starch solution with the macronutrient profile, which did not pay off. When I stopped exercising, and I'm not even joking, on a 1,800 calorie diet, which is not a ton of calories for somebody my size, I got fat as hell by the hormonal issues it caused by me not exercising like a maniac. When I was exercising for 6 to 8 hours a day, 3 to 6 times a week. Sometimes it would be 3 times a week, sometimes it would be 5 times a week, sometimes it would be 6 days a week, sometimes it would be 7 days a week I'd exercise. But I was exercising for 6 to 8 hours a day sometimes. Usually, I would say average of 6 hours a day, because I had the time and I wanted to really test this out and push my body to the limit with this idiotic starch diet. And once I stopped, I got really ripped. I got really big. But once I stopped the psychotic exercising, bad things started to happen. My body, I started gaining belly fat. and then I started getting breathing issues, and then I started getting heart palpitations, and then I started getting chest pain, and then blah, blah, blah. Now, in fairness, this was also at a time when I had a unique amount of stress in my life between two women. I was trying to juggle two women, apparently, even though I didn't know that's what I was doing. And apparently a lot of health problems with my ex-girlfriend, and I had to take care of her. And then the other one stopped talking to me, and yada, yada, yada. And, of course, I was stressed out because I'm taking care of somebody, and I'm doing this and doing that, and I'm not I think I'm eating right. I'm eating the starch solution, but I'm not exercising enough anymore. And the only exercise I got was in housework and taking care of the chick, my ex-girlfriend, and it wasn't burning up the carbohydrates like it needed to be. And I am a firm believer in a low to moderate carbohydrate diet. That is the diet I thrived on. That is the diet I will promote to most people. Okay? I don't think a high carbohydrate diet is healthy. I just don't. It never paid off for me. It never paid off for anybody I was trying to get to lose weight when I was coaching people on how to lose weight. I will always promote a low to moderate carbohydrate diet, and I will always encourage people to eat a 100% plant-based diet because it is healthiest if it's done right, and it is an ethical decision that people should be making, in my opinion. But if people aren't making that ethical decision, I'm not going to keep them from making that decision by shoving it down their throat. And that's all for this video. Read the links in the description about how calcium helps with anxiety, how calcium helps with heart conditions, how calcium helps with depression and psychiatric issues. And, educate yourself. And of course, I'm not a doctor, I'm not a physician, not a dietitian, none of that stuff. Don't take anything in this video as advice. It's not advice, it's entertainment.